What is the history of relapse prevention models? Imagine trying to stay on a diet or quit smoking without knowing what might trip you up. That's where relapse prevention models come into play, and their story begins in the late 20th century. These models were created within cognitive behavioral therapy, which focuses on changing thoughts and behaviors. During the 1980s, researchers noticed many people struggled to stay in recovery from substance abuse and other issues. They wanted to find ways to help people keep their progress long-term. Alan Marlett and his team were key figures in developing these early models. They saw relapse not as a failure but as a process that could be understood and managed. They identified that certain situations or thoughts could trigger a relapse. So, they focused on teaching people how to recognize these high-risk moments. The goal was to help individuals develop skills to cope with cravings, manage stress, and challenge negative thinking. This approach involved self-monitoring, which means paying close attention to one's feelings and behaviors, and cognitive restructuring, which is changing unhelpful thoughts. As time went on, relapse prevention models expanded beyond just substance use. Therapists started applying these ideas to mood disorders like depression. They developed maintenance phases of therapy to help prevent recurrence of symptoms. Research showed that ongoing cognitive therapy could significantly lower the chances of relapse. This proved that teaching people skills and helping them understand their risks could make a real difference. More recently, mindfulness has been added to these models. Mindfulness-based relapse prevention combines traditional cognitive behavioral techniques with mindfulness meditation. This helps individuals become more aware of their triggers and urges without reacting automatically. It encourages acceptance and awareness, which can reduce the likelihood of relapse. In practice, therapists assess each person's specific risk factors. They teach coping skills tailored to individual needs and plan for situations where relapse might happen. Many programs include booster sessions to reinforce skills over time. Overall, relapse prevention models have grown from simple ideas into comprehensive strategies that help people stay in recovery by building resilience, self-awareness, and control.